GLP-1 medications like Ozempic, Wegovy, Mounjaro are everywhere right now, and they're being hailed as a miracle for weight loss. But what if I told you there's another option? A cheaper, effective, and possibly safer alternative that your doctor probably didn't mention. That's what we're diving into today. GLP-1s versus Contrave, which is a combination of two medications, naltrexone and bupropion. Which one is actually better for weight loss? What are the risks no one's really talking about? And more importantly, how do you know which one's right for you? Stick around because this could save you thousands of dollars as well as a lot of side effects. So let's start with why GLP-1s like Ozempic and Mounjaro are really dominating the weight loss world right now. Originally designed for diabetes, these medications work by mimicking the natural gut hormone called GLP-1, which helps to slow down digestion and it makes you feel full longer. Sounds great, right? The results, they work. People tend to lose somewhere between 10 and 15% of body weight on average. But there's a catch. Well, several actually. First, the side effects. We're talking nausea, vomiting, diarrhea, stomach paralysis, and even muscle loss. Second, they're expensive, really expensive. If your insurance doesn't cover it, you're looking at somewhere between $800 to $1,500 a month out of pocket. Thirdly, there's the issue of muscle loss. So the studies show that GLP-1 users can lose a significant amount of lean muscle if they're not doing resistance training. And that's a really big deal, especially for longevity and metabolic health. And one thing I've personally noticed in clinical practice, and yes, I do recognize that this could be a sample bias, is I'm seeing quite a few complications from these drugs. I've seen cases of severe nausea, extreme weight loss beyond what was even healthy, as well as patients who've developed these persistent GI issues long after stopping the medications. Beyond that, there are also emerging concerns about how these drugs impact long-term metabolic function. While they suppress appetite, they don't necessarily fix the underlying metabolic dysfunction or help patients build healthier eating habits. If anything, they can create a situation where people feel dependent on the medication just to maintain their weight loss. But here's where things get interesting, because these drugs are not the only option for weight loss. And in some cases, they may not even be the best option. So let's talk about naltrexone and bupropion, or AKA Contrave. So this is an oral medication, which means there's no injections required, and it works completely differently than GLP-1s. So instead of impacting or affecting your digestion, it actually works on the brain. Firstly, bupropion, it increases dopamine levels, which really help with food cravings. And the naltrexone, it actually reduces that reward feeling you get from overeating. So in other words, it's rewiring how your brain responds to food. Think of it like this. GLP-1s are basically work kind of like putting a lock on your fridge, so it really limits how much you can eat. Contrave works by rewiring your brain so you don't even want to overeat in the first place. Now, the important question, does it work? Well, the good news is yes. What the studies show is that patients tend to lose somewhere between 5 and 10% of their body weight, which while slightly less than a GLP-1, it really helps to target those people who struggle with food cravings, binge eating, and emotional eating. And here's a big plus. It doesn't cause the same GI distress or muscle loss that GLP-1s do. It's also significantly cheaper and covered by insurance more often. One other thing that's often overlooked, Contrave can also have positive mental health benefits as well. Bupropion is already used as an antidepressant, and some people find that it helps them feel more motivated, focused, and in control of their eating habits. So let's do a little bit of a side-by-side comparison. First, with the GLP-1s, you can expect to lose somewhere between 10 and 15% of your body weight. Contrave, on the other hand, it's going to be somewhere closer to 5 to 10%. The GLP-1s work by slowing your digestion and also reducing your hunger. Contrave, again, it works in the brain, so it helps to reduce your cravings and it really, it rewires your brain's reward system. In terms of side effects, GLP-1s, nausea, vomiting, GI issues, muscle loss. Whereas with Contrave, some patients do report some mild anxiety, as well as insomnia and a headache. The cost difference, the GLP-1s somewhere between $800 and $1,500 a month, whereas with Contrave, it's going to be closer to $100 to $200 a month, and it's oftentimes covered by insurance. GLP-1s are best for those with metabolic syndrome or some degree of insulin resistance. Contrave, on the other hand, is really better for food addiction and anyone who kind of engages in emotional eating. And lastly, with the GLP-1s, it requires an injection, whereas with Contrave, it's just a simple pill. Look, GLP-1s work, but they're not the only option. And for some people, they're not the right option. If your doctor only told you about Ozempic and never told you about Contrave, they really didn't give you the full picture. And if you have experience with either one of these medications, I'd love to hear about it in the comments section. And as always, if you found the video helpful, please, hit like and subscribe. Thank you.